When you're pregnant, every flutter, ache, or change in your body can make you wonder how your baby is doing. While pregnancy can be full of uncertainties, there are some clear signs that can tell you if your baby is healthy or if there might be a problem. Understanding these signs can help you feel more confident and know when to seek medical advice. Let's look at the signs of a healthy pregnancy and the signs that something might be wrong. Signs of a healthy baby in the womb. 1. Movement after 20 weeks. One of the most exciting moments for expecting parents is feeling the baby's movements. Around 20 weeks, you may begin to notice flutters, kicks, or rolls in your belly. These movements are signs of a growing and active baby. By the 6th month, your baby may respond to sounds, and by the 7th month, they might react to light and even mild discomfort. Paying attention to these movements and their patterns can be reassuring. 2. Normal growth. Ultrasounds are essential for monitoring your baby's growth. On average, a fetus grows about 2 inches per month. By the 7th month, they should be approximately 14 inches long and weigh around 2 pounds. By the end of pregnancy, a healthy baby usually measures 18-20 inches and weighs about 6.6 pounds. Your healthcare provider will monitor your baby's size to ensure they're developing as expected. 3. Strong heartbeat. Hearing your baby's heartbeat for the first time is a magical moment. A healthy fetal heartbeat can typically be detected around the 5th week of pregnancy, ranging between 100 and 160 beats per minute. Regular checkups allow doctors to monitor this vital sign, which is a good indicator of your baby's overall health. 4. Healthy weight gain. For mothers, gaining weight is part of a healthy pregnancy. Most women gain between 25-35 pounds during pregnancy. This weight reflects the baby's growth, as well as the increase in fluids and tissues needed to support the pregnancy. Your doctor will track your weight gain to ensure it aligns with your baby's development. 5. Morning sickness. Though morning sickness can feel unpleasant, it is often a sign of a healthy pregnancy. It typically occurs in the first trimester and is linked to the hormonal changes your body undergoes to support your baby. This nausea can help lower the risk of miscarriage and indicates that your body is producing enough hormones to sustain the pregnancy. 6. Breast changes. Enlarged and tender breasts are among the earliest signs of pregnancy. The rise in estrogen and progesterone prepares your body for breastfeeding. While it can feel uncomfortable, this change reflects a body in tune with its pregnancy needs. Signs of an unhealthy baby in the womb. 1. Low HCG levels. Human chorionic gonadotropin is a hormone crucial for maintaining pregnancy. While HCG levels naturally fluctuate, consistently low levels may signal an undeveloped fetus. If you're concerned about your HCG levels, your doctor can run tests and provide insights. 2. Abnormal fundal height. Fundal height is the measurement from the top of the uterus to the pubic bone. It gives doctors an idea of your baby's growth. If this measurement doesn't match your stage of pregnancy, it could point to issues such as too much or too little amniotic fluid or improper fetal development. In some cases, it might also indicate a breech baby, which may require medical intervention. 3. Lack of heartbeat. A baby's heartbeat should become easier to detect as the pregnancy progresses. If a heartbeat is present at one appointment but absent at the next, it may indicate a miscarriage. Doctors can use advanced imaging and monitoring to confirm the situation and guide you on the next steps. 4. Excessive cramping. While mild cramping is common, severe cramps, especially in early pregnancy, can be a red flag. This type of pain may suggest complications, such as an ectopic pregnancy, miscarriage, or placental issues. Any sharp, persistent pain warrants immediate medical attention. 5. Bleeding. Bleeding during pregnancy is always a cause for concern. While spotting can occur during implantation, heavy bleeding might indicate a miscarriage or other complications. Contact your doctor immediately if you experience any bleeding. 6. Severe back pain. Back pain is common as the body adjusts to the growing baby. However, extreme back pain that radiates to the front may indicate preterm labor or other issues. Persistent and severe pain should not be ignored. 7. Unusual vaginal discharge. During pregnancy, vaginal discharge is typically clear, or whitish and odorless. A greenish or yellowish discharge with a strong smell could signal an infection or cervical inflammation. Such conditions may increase the risk of miscarriage if untreated. 8. Sudden loss of morning sickness. Morning sickness generally subsides by the end of the first trimester. However, a sudden disappearance of symptoms, especially before this period, could indicate low HCG levels and potentially a miscarriage. Consult your doctor if you notice such changes. 9. No fetal movement. Once fetal movements become consistent, you should feel your baby kick or move multiple times each day. A sudden drop in activity or no movement at all could indicate fetal distress. Experts recommend counting movements to ensure your baby is active. If movements slow or stop, seek medical advice promptly. Additional factors to consider. Prenatal care. Regular prenatal visits are critical to ensuring both your health and your baby's. During these appointments, your doctor will check vital signs, run tests, and monitor the baby's development. Keeping up with these visits allows early detection of any potential issues. Maternal health. The health of the mother directly impacts the baby's well-being. Conditions like gestational diabetes, high blood pressure, or infections can affect the fetus. Eating a balanced diet, staying hydrated, and avoiding harmful substances like alcohol and tobacco are essential for a healthy pregnancy. Stress and emotional well-being. Stress and anxiety during pregnancy can influence fetal development. Chronic stress may affect blood flow to the baby and increase the risk of preterm labor. Practicing relaxation techniques like deep breathing, yoga, or meditation can help. Monitoring fetal health at home. Many mothers worry about their baby's health between checkups. Keeping track of your baby's movements, eating a nutritious diet, and listening to your body can give you insights. If something feels off, trust your instincts and consult your doctor. When to seek medical help. Severe abdominal pain or cramping. Mild cramping can be normal, especially as your uterus expands. However, severe or persistent abdominal pain could indicate serious issues like ectopic pregnancy. This occurs when the fertilized egg implants outside the uterus, often in the fallopian tube. It can cause sharp pain and is a medical emergency. Miscarriage. Cramping in the first trimester accompanied by bleeding might signal a miscarriage. Placental abruption. Later in pregnancy, severe pain might indicate the placenta has detached from the uterus prematurely, cutting off the baby's oxygen supply. Any sharp or lasting pain should be evaluated promptly to rule out these complications. Fever or signs of infection. A fever above 100.4 degrees Fahrenheit or 38 degrees Celsius during pregnancy could indicate an infection, which might harm both you and your baby if left untreated. Possible causes include urinary tract infection. Common in pregnancy, UTIs can lead to kidney infections or preterm labor if not managed. Influenza or respiratory infections. These may pose higher risks to pregnant women due to a weakened immune system. Amniotic infection. In later pregnancy, fever combined with abdominal pain or unusual discharge could point to an infection in the amniotic sac, requiring immediate treatment. Accompanying symptoms like chills, fatigue, or unusual pain should also prompt a call to your doctor. Other signs to watch for. 1. Decreased fetal movement. If your baby becomes less active or stops moving altogether, it may indicate fetal distress or oxygen deprivation. Counting kicks and paying attention to movement patterns can help identify changes early. 2. Sudden loss of pregnancy symptoms. If nausea, breast tenderness, or other typical pregnancy symptoms suddenly vanish in early pregnancy, it might signal a miscarriage or hormonal imbalance. 3. Contractions. Before 37 weeks. Regular contractions or a tightening sensation could indicate preterm labor. Seek medical advice if the contractions are frequent or painful. 4. Leaking fluid. A sudden gush or continuous trickle of fluid could mean your water has broken prematurely. Immediate medical care is essential to reduce infection risks. 5. Chest pain or breathing difficulty. Rare but serious. These symptoms could indicate a blood clot, heart issue, or other emergencies that demand prompt attention. What to do in an emergency? Stay calm. Stress can worsen symptoms. Focus on getting help rather than panicking. Contact your healthcare provider. Call your obstetrician or midwife immediately to explain your symptoms. They can guide you on whether to come in for an evaluation or go to the hospital. Visit the emergency room. If the symptoms are severe or life-threatening, go to the nearest emergency room. Inform the staff that you're pregnant so they can provide appropriate care. Final thoughts. Pregnancy is a time to be vigilant about your health and well-being. While many symptoms can be normal, knowing the warning signs can help you act swiftly when something feels wrong. Trust your instincts and prioritize regular prenatal care to catch potential issues early. Your healthcare team is there to support you every step of the way, so don't hesitate to reach out when in doubt.